The Avanos Introducer or Initial Placement Kit delivers a complete solution designed to aid in an efficient initial placement of a balloon-retained feeding tube while reducing major complications such as infection and skin irritation. Multiple kit versions are available to support placement of MIC and MICKY, gastrostomy, jejunal, and gastro-jejunal tubes. This video highlights the key steps for using the kit's T-fasteners, dilator, and stoma measuring device prior to low-profile G-tube placement. The Avanos gastrointestinal anchor set with safety PEXI T-fasteners provides gastric fixation to affix the stomach to the anterior abdominal wall. We'll review the key steps for using the T-fasteners, assuming all prior IFU steps have been completed. Insufflate the stomach to allow the safety PEXI needle insertion and T-fastener deployment. Attach a syringe containing water or saline to the safety PEXI needle hub. Insert the pre-loaded safety PEXI needle until it is within the gastric lumen. The return of air into the syringe confirms correct intragastric position. Bend the locking tab on the hub. Push the inner hub into the outer hub until it clicks into place, dislodging the T-bar from the end of the needle. Withdraw the needle while continuing to gently pull the T-bar until it is flush against the gastric mucosa. Gently slide the suture lock down to the skin surface. When all three suture locks are in place, close the suture lock until an audible click is heard. Next, we'll use the telescoping dilator to create the stoma tract. The Avanos telescoping dilators reach desired dilation with a single proprietary device, facilitating efficient feeding tube placement. With the guide wire in place, use a twisting motion while advancing to create a tract into the gastric lumen. Hold the dilator stationary, grasp the next dilator sleeve, and slide the segment forward until physical stop is felt. During the dilation process, the stoma is measured using the stoma measuring device to ensure proper fit. Clinical literature reports an ill-fitting tube can lead to skin issues, including hypergranulation tissue. With the guide wire in place, advance the stoma measuring device through the stoma tract and into the stomach. Inflate the balloon with sterile or distilled water. Slide the plastic disc down to the abdomen. Deflate the balloon and remove the stoma measuring device. Once dilation and stoma measurement are complete and the peel-away sheath from the telescoping dilator is peeled down, complete the placement of the Avanos feeding tube. The Avanos Introducer Kit delivers all the essential tools for an efficient and minimally invasive placement. For more information, please see the IFU or contact Avanos.